A third of the population was typically receiving opioids for management of their musculoskeletal claims going back to around 2018, even despite the fact that the CDC has put into place guidelines for primary care to reduce the use of opioids. There are still quite a few construction workers that are being prescribed opioids to manage their chronic pain.
Opioids help manage pain, but they may cause euphoria and decreased cognitive awareness.
At the workplace, we're concerned that they may inadvertently cause harm to themselves or others by creating unsafe situations.
An overwhelming body of research consistently indicates that construction workers have the highest rate of opioid overdose compared to all other industries. This is due to many compounding factors within the industry, including physically demanding work, a lack of paid time off, and a well-documented mental health crisis.
So the easiest treatment is for them to pop a pill and go back to work.
To develop these guidelines, Anne-Marie and her team looked at health claims data from construction trades to understand the rates of injuries and how it correlates to prescriptions of opioids.
So in 2015, we looked in their health claims data, and in fact, we saw that musculoskeletal disorders, first of all, were very prevalent. Many workers were receiving diagnoses of musculoskeletal disorders, and in fact, many of these workers were quite young, 25, 28 years old. And furthermore, a large portion of them were being prescribed opioids as their primary treatment and only treatment in many cases for the musculoskeletal disorders. We realized that individuals who were opioid naive, which means they had not previously been prescribed opioids, once they were prescribed opioids, within 1 year, they were 10 times more likely to also have a diagnosis of opioid use disorder. For the chronic musculoskeletal disorders, they were receiving opioids for very long periods of time.
The workplace guidelines to prevent opioid and substance abuse for the construction trades were made in conjunction with trade unions and construction employers to ensure their perspective and needs were accounted for. This is how the guidelines work.
So the guidelines provide the critical information a company would need to develop an opioid prevention program. It covers the basic elements. It provides a step-by-step process on how they can develop their plan. It includes a very large number of resources. Many of them are free, and it even includes information that is state-specific. There is a basic how to get started portion of the guidelines. So a company can conduct a needs assessment. For a company who has nothing in place, this gives them a first step, and it guides them on picking which element they need to get started. A company that already has some elements of an opioid prevention program in place can use the needs assessment to see what elements they may have already covered, but it will enlighten them into other aspects they may not have considered.
Additionally, the guidelines include an overview to the 8 essential elements of an opioid prevention and treatment program. Those 8 elements being culture of care, employee education, supervisor training, substance use policy, drug testing program, healthcare and pharmacy coverage, employee or member assistance program, and legal considerations.
For employers that are resistant, it's important to understand where they're coming from. Do they understand the fact that they likely have individuals in their workforce that are struggling with opioid use, because opioids are so commonly prescribed, and it is not uncommon for individuals once they initiate to actually continue using and move into addiction. The second thing is to help them understand that this is a disease, and therefore, as a disease, it is treatable. I think it's important for these employers to realize that there is hope that many of these individuals do reach recovery, and once they get into recovery, they actually are very grateful that the employer was there, supported them, and brought them back to the workplace.